I'm Christy Campbell with the Cole County Health Department, and this is our semi-regularly scheduled COVID press briefing. We try to give an update of goings on in the county. I'm really pleased to report that our positive cases remain at low levels. Our website showing that we've had 5 positive cases reported to us in the last 7 days, and our positivity rate is at 2% of on our Dasher report from last week. Information specifically about the cases in Cole County, the positive PCR test and the antigen test can be found at showmestrong.mo.gov, as well as our website, colehealth.org. The vaccination rates are slowly climbing as our supply has increased in Cole County, and the demand is decreasing because of the amount of those who have already sought vaccination. So as of this morning, Cole County's vaccination rate was at 37.4%, and Missouri is just a little over 50% at 50.7%. Today we have a lot of experts on the line who are going to talk some more about vaccination. So with that, we'll go right to Capital Region Medical Center and Dr. Haight.
Hello, everyone. As Christy has said, our hospital numbers continue to be very low. We're ranging from 0 to 3 patients at any one time with a COVID diagnosis. What has been really good, if you look across the state, especially our older population, and those are people 60 and older, have been vaccinated in the 70% range, which is excellent, as that has helped reduce the spread of COVID, especially in our older population. We continue to encourage patients to receive the vaccine, and because of that, we have 2 physicians here with us today. The first one is Dr. Pauline Burrell, who's one of our pediatricians at Capital Region, and the other physician is Dr. John Olson, who's one of our obstetricians. So we're going to start with Dr. Burrell to talk about vaccination in the pediatric population.
So recently, the approval came for emergency use for the 12 to 15-year-olds, which was wonderful to tack that on to the older age group with the Pfizer group. The studies were shown for it to be greatly effective, 100% efficacy in the study group that was in that 12 to 15-year-old age group, which was fantastic. Side effect profile is essentially the same as it is in the previous studies above that age group. So there's no increased side effects in this age group. As a pediatrician, we're definitely recommending it and sending our patients to the local health department sites to get that done, or local pharmacies as well. Parents do have quite a few questions, as they always do, pertaining to vaccines. There's hesitancy out there, but we are definitely on board with encouraging them to get this. It's the same dose as the adults get. It is 3 weeks apart from first to second dose with Pfizer, and then considered fully protected after the 2 weeks after your second dose. Side effects, like I mentioned, are the same as adults, with a sore arm and maybe feeling fatigue or fever for a few days. Outside of that, they saw no other side effects, and the efficacy, like I said, was 100% in the study group, which is just really great.
And Dr. John Olson is going to speak. He is an obstetrician at Capital Region, especially those women of childbearing age who have some questions. So Dr. Olson.
So we're seeing more and more pregnant women opt in for the vaccination. I don't know the exact percentage numbers, but it seems like a majority of them are. American College of Obstetricians and Gynecologists, along with the AMA, have shown that the vaccine safety for all 3 vaccines is very high in pregnancy. They've also shown that the antibodies that you make cross the placenta and cross into the baby, meaning it can help them once they're delivered. There's no time restriction on it as far as first, second, or third trimester, and there's no increased side effects during pregnancy as far as other than the general population. As far as women of childbearing ages that aren't pregnant, there's no studies out there to show that there's any change in their reproduction, no change in teratogenesis or anything like that. There is one study ongoing to see if it does change menstruation cycles for a cycle or 2. but they're looking at that and comparing it to other vaccinations and realizing that that might be something that happens with a number of vaccinations, not just with the COVID vaccines.
So thank you, Dr. Burrell and Dr. Olson. And again, we encourage people that do have questions regarding the vaccine to please reach out to their healthcare provider, physician. And if you don't, you can reach out to any of our institutions and we'll route you to one of us to be able to answer your questions. So again, I was very excited personally, as my youngest daughter, who's 15, has been waiting for the vaccine, and I believe she is going out today to get her vaccine at the mall site. So that will be her first of the 2 vaccines. So again, thank you, and thank you, Christy.
Thank you, Dr. Hay, Dr. Burrell, and Dr. Olson for that information. Mr. Hyde from SSM St. Mary's.
Sorry, couldn't get off mute. Yeah, just a quick update for us with Dr. Adams absent today. Our numbers continue to be low here from a COVID perspective in the hospital. So that tends to continue to be a trend for us. We're obviously prepared for any potential surge, but it's great having, a breather for the community to not have, any COVID patients to speak of in the hospital. We're continuing to try to, just like we've been talking about with vaccination, be prepared for managing that in our clinics here within SSM as well. So really it's a major focus on prevention and immunization at this point versus, managing COVID patients. Aside from that, I don't really have a lot to update.
Thank you. Dr. Sullivan with the Community Health Center of Central Missouri.
Good afternoon. We continue to take our mobile unit into the community to provide vaccines to those that may have trouble making it to the sites for vaccination. We are continuing to work with the United Way in the food pantry in providing vaccines at those mobile food pantries. So yesterday we were at the Boys and Girls Club here in Jefferson City, and we will be continuing to be at select food pantries through June. Next week, we'll be at St. Martin's Catholic Church on Wednesday, May the 26th from 4 p.m. to 6 p.m. That same day, May 26th, we're also going to be at the Joshua House Church from 4 p.m. to 8 p.m. And this is an event that's a collaborative effort between us, the Community Health Center, the Joshua House Church, Missouri Faith Voices, and the NAACP. And so vaccines will be available at the Joshua House Church for anyone 12 years old and above. So that's again at the Joshua House Church on May the 26th from 4 to 8 p.m. And also at St. Martin's Catholic Church that same day from 4 to 6 p.m. That's all that I have for this afternoon.
Thank you, Dr. Sullivan. Do people need to register for those events through Vaccine Navigator, or is it just walk up?
They just walk in. Yep, no need to register, nothing, just walk in.
Okay, thank you very much. Ron from JCMG.
Good afternoon. So JCMG continues to see a low number of patients presenting both with COVID symptoms and that have positive tests. We continue to provide vaccinations through our COVID vaccine clinic here, which is accepting walk-ins as well. We also are giving, of course, the Pfizer vaccine starting at age 12. I did want to mention that the Building Community Bridges partnership that we had, we were scheduled to administer second doses this Saturday at East Miller Park. Building Community Bridges has ended up canceling that event. We are going to be meeting those patients that are needing a second vaccine at the BCB location, which is off of East Ashley Street in Jefferson City. In a previous press conference, we mentioned we were going to be at East Miller Park, also giving Johnson & Johnson, but with the change in schedule, we'll just be administering those second Moderna doses. We certainly do have an adequate supply of Johnson & Johnson, so if there are residents in the area, of course, we're happy to immunize you with that here at JCMG as well. Thank you.
Thank you, Ron. Commissioner Bushman.
It turned on. And you can also get vaccinated at the Hy-Vee, the Walgreens, the Walmart West, and the Gerb's pharmacies. But again, with our mobile clinic, if there's some events coming up where there's a lot of people, let us know in a timely fashion. And, we can come out to a parish picnic or a sporting event or something like that, because we really do want to get the biggest number of people vaccinated we can. So we will come to you. Just let us know. We've got to make sure we get vaccinators out there. But with the mobile clinic we've got that through Community Health Center, we can come to you. Just let us know. Just ask.
Thank you, Commissioner Bushman. Mayor Turgeon.
Thank you. And I want to also thank and appreciate the helpful and trusted advice that we have received from our pediatrician and obstetrician, and the continued advice from our local doctors that continue to serve our community and get this information sent out to everyone. We also appreciate the Cole County Health Department putting out information for us on their Facebook page. If you want to see the changes in, for example, the mall site as they change their hours, keep an eye on that so that you can watch their Facebook page, Cole County Health Department, and see all the latest information and stay up with that and share that with your family, friends, and coworkers, because we've made it so very easy here in Cole County to get the vaccine. All of the things that were mentioned previously, of course, it is open to Missouri residents. You don't even have to necessarily live in Jefferson City or Cole County in order to get it here. So we've made it very easy. I received my vaccination as soon as it was eligible, and now we are all eligible to get that here. So certainly want to encourage people to get it. It's so easy, and we appreciate everybody doing what they can so that we keep our cases low. Thank you.
Thank you, Mayor Turgeon. I want to touch on the Cole County community vaccination site just a little bit. So last week, we did a total of 894 vaccinations. 172 of those were first doses. This week, there was about 153 scheduled. I know we've probably done more than that. There was 102 first doses, but a lot of those second doses that were due this week were probably walk-ins because, as stated, appointments aren't necessary there. You can just walk in. It does save a little time if you register at covidvaccine.mo.gov through the Vaccine Navigator site. But you don't have to be registered. You walk in, it'd still be about 8 to 10 minutes. If you register beforehand and have your patient ID, you literally will just take you a minute or two to check in, and then they'll get your vaccine and you'll wait your 15 minutes and be on your way. So it's a very simple process. The site is offering, it was open Monday through Thursday of this week. So today is Thursday, the hours are 9 to 6. Next week, because of the decrease in demand, we are moving to 2 days. So on Monday, it'll be open from 9 to 3:30 and Thursdays 9 to 6. So that's open on the 24th and the 27th of May. And then the site will be closed on May 31st to observe Memorial Day. So it'll just be open on Thursday of that week. But as Sam stated too, I wanted to emphasize that most of the retail pharmacies here in Jefferson City have the vaccine. So if those hours aren't convenient for you and you have a desire to get the vaccine, Walmart and Walgreens, and then Hy-Vee is carrying the Pfizer vaccine. I think the other ones might have the Moderna and the Johnson & Johnson if that's what you're seeking. But if you have the 12 and up age group, Hy-Vee has Pfizer, and they are available to give vaccinations anytime the pharmacy is open and you do not have an appointment. So just feel free to seek out any of those options. There's also been some news stories about the National Guard discontinuing their support at the end of May. They've been a fabulous help to us, and we couldn't have done, everything that we've done with the mass vaccination sites and running the clinics without them. But it's time for them to get back to their real jobs, and we're so thankful for their help. So their support will end at the end of May. But thankfully, we have great community partners here in Jefferson City, and we're going to continue to have that central vaccination site at the mall open through June and probably part of July. And then we're going to see what the demand is like and phase out. There'll still be plenty of opportunities to get vaccinations in Cole County, and we'll make sure to communicate all those changes with you. But we just wanted to let you know that the site will not be closing when the National Guard is no longer there to help support it. So all the information about vaccination rates or the events coming up through Vaccine Navigator can be found at that covidvaccine.mo.gov website. Is there any other panelists that would like to offer anything? Director Thomas, I see you're on the call today. Is there anything that you would like to add?
No, just a huge thank you. You guys have done an amazing job for our county and our citizens, and it's just impressive. So thank you, all of you.
Thank you, Dr. Thomas. We appreciate your assistance as well. So at this time, I'd open up to any questions or comments from any of the panelists or questions from our press partners that joined today. I guess we just did a great job providing all kinds of information today. I'm not hearing any questions and I'm not receiving any in my email. So everyone have a great day and have a great weekend. Take care.